Diagnostic approach of hypercalcemia. So here there is elevation or the corrected serum calcium levels, and this should be done on repeated testing. So on repeated testing, if values are being positive, then this is the algorithm to be followed. Firstly, measure the PTH. In cases where the PTH is high, normal, or totally elevated PTH, in such case, we look at the urinary calcium. If the urinary calcium is greater than 250, so this is mg per 24 hours, that's a day. So in such a case, it can be due to the primary and tertiary hyperparathyroidism. And next, in cases where the urinary calcium is less than 100 mg per 24 hours, such a case, it can be due to the familial hypercalcemic hypocalciuria. Next, the other spectrum, that is, there can be suppressed PTH that is less than 20 pg per ml, and then what is done is the measured values of PT, HRP, 25 OHD and 125 OHD are considered. So in cases where there is elevated PT-HRP, it can be for the evaluate for the solid tumor malignancy. Next, in cases of the elevated 125 OHD, so here the chest X-ray is done. This is for the possibility of lymphoma or a sarcoid. Next, there is elevated 25 OHD, which is nothing but the vitamin D toxicity. Next, there can be, in cases of the normal lab values, the conditions or the causes can be due to the hyperthyroidism, or it can be due to the multiple myeloma, adrenal tumor, vitamin A toxicity, and the immobilization or the milk alkali syndrome.